In this video, I'm going to talk about lumbar traction, what it is, who should try it, and how to do it. I'll also cover 3 different home traction devices that you can try. Traction is basically the stretching of the lumbar spine in the axial plane. When you're in an upright position that is standing or sitting, the forces of gravity compress your discs and your facet joints together. That pressure squeezes out the fluids, and if it isn't corrected, your disc will start to desiccate or dry out. The pressure also jams together the facet joints. Those are the posterior joints of the spine. It can damage the cartilage that lines them, leading to degenerative joint disease. So it would be beneficial if you could stretch the spine, separate those vertebral segments, and create some space in between those facet joints. Doing so will create a negative pressure which can draw in fluids into the disc, effectively rehydrating it. So if you have low back pain, back stiffness, muscle tightness, then lumbar traction is something you should try. Now, is it safe? You know, the lumbar spine is the strongest area of your spine. It could take pretty significant force. However, if you have an odd condition such as retrolisthesis, spondylolisthesis, or spinal stenosis, or osteoporosis, then you want to check with your doctor first to make sure that home traction is safe for you. There are 4 devices on the market that I've tried and I can recommend to you to do home lumbar traction. The first one is the Teeter Inversion Table. Now, the advantage of this table is that it does stretch your spine pretty well. It actually stretches your whole spine, and it's easy to operate. The disadvantage of using the inversion table is that you're inverted. You're upside down, and this doesn't work well with some people. It can cause nausea. It's very uncomfortable. The blood rushes to your head, and it could trigger a headache. If you're susceptible to migraines or dizziness or balance problems, then the inversion table is not for you. Also, it puts significant stress to your ankles, your knees, and your hips. If any of these joints are giving you problems, then again, the inversion table is not for you. The second device is called the Batboat. It is basically an inflatable harness that's suspended with a cord, and it has a high tension spring attached to it. You attach the cord to an immovable object above you, put on the harness so that when you bend your knees, the cord resists and the spring resists, and the weight of your pelvis and your lower legs stretches your back. You could also do it in the supine position where your legs are pointing to the ceiling and you use the weight of your body that pulls downwards. I like the back bubble over the inversion table because it's more comfortable, so you're more likely to do it, and you could do it for longer periods. It's so comfortable that you could do the traction while you're watching TV or reading a newspaper. You could get a constant traction by bending your knees and staying in that position, or you could do repetitive traction by bending and straightening up your knees. The third device is called the Stamina Inline Traction System. Now, what I like about this is that, again, it's comfortable, you're in the upright position, and you grab handles in the front. There's a band that goes across your thighs, and when you bend forward at the waist, the band immobilizes your hips and your lumbar spine while your upper body bends downward, and that creates an axial inline traction effect to your low back. You could either maintain the forward flexion position, or you could have intermittent traction where you bend forward, come up, bend forward, wait for about 30 seconds, then come back up, and so on. And the last device is the posture pump, or elliptical spine trainer. You place it under your low back, lay down comfortably, bend your knees, and it's got these air bladders that you pump up. And due to their angle, they spread apart your lumbar spine while extending it at the same time. So you get extension, which puts your low back in a nice lordotic curve, and some degree of traction. Not as strong as the previous 3 devices, but you get traction with the extension. I recommend the posture pump for those who have hypolordotic lumbar spines, i.e. flat or straight lumbar spines. Ideally, your low back, your lumbar spine should have a gentle curvature to it. That curvature acts like a spring. That spring action absorbs some of your weight, and it's not just placed on your joints, on your discs and your facet joints. The elliptical posture pump is great for maintaining that lordotic curve or increasing that lordotic curve and tractioning at the same time. You could pump it up, release the air, pump it up again in cycles to get an intermittent traction, or you could pump it up to your max tolerance and lie down there for several minutes to get a sustained traction effect. Now, you could make traction more comfortable and more effective by doing about 20 minutes of infrared heat lamp therapy to your low back. The heat of an infrared lamp penetrates deep into your muscles. It relaxes them, loosens them up, oxygenates them, brings blood to the muscles so that when you do the traction, those muscles won't guard as much and you'll get a greater stretch. So that's it. Again, lumbar traction is appropriate for those who have low back pain, general low back pain. It can increase hydration to your lumbar disc, and it relieves some of that pressure to your facet joints so that the cartilage doesn't get damaged. If you want to try any of these devices, click the small circle in the upper right corner of the screen. It'll take you to a link that describes the product in more detail.